Namaste all. We are here today with Dr. Arun Srinivas, one of the leading cardiologists in Karnataka, who has been awarded fellowship by leading institutes in USA, Europe and Australia. He is the only cardiologist in Mysore who has obtained international training in coronary, pediatric and peripheral vascular interventions. All this backed by a rich 3 decades of experience as consultant interventional cardiologist. He has pioneered cardiovascular care in the city of Mysore and has served the people of Mysore and surrounding districts for more than 2 decades now. With a rich 10 years of teaching experience adding, he has participated in over 30 clinical cardiovascular trials as principal investigator, and the list goes on. He's published numerous publications as well and actively takes part in knowledge growing activity. I welcome you, sir.
Thank you. Thank you.
It's a privilege to have Dr. Arun Srinivas with us today. He is skilled in performing coronary angioplasty stent implantation, primary angioplasty during acute myocardial infarction, pediatric cardiac interventions, rotational arthrectomy, pacemaker, ICD, CRT, the list goes on. And today we are here to discuss a very important topic on heart attacks. We will be celebrating World Heart Day this month, and only yesterday there was news of a young actor in his 40s passing away due to heart attack. This raises many questions about the heart health of young Indians, and today we are here to discuss this important topic with none other than the expert himself. Welcome to Dr. Arun Srinivas.
Thank you. Namaste.
To begin with, sir, how does one suspect heart attack, and how do we come to know that one is having a heart attack, and that crucial hour of reaching out to the hospital on time, which is also known as the golden hour? What is the importance of this urgently reaching to the hospital?
I think that is an extremely important part of treatment of heart attack is first to diagnose what the problem is. Now, heart attack can be suspected in anybody who has got discomfort in the chest. It can be in the center of the chest most of the times, and many times it can radiate toward the shoulders, arms, elbows, or even up to the jaw. And most people think that heart attacks, the chest pain should be on the left side. But unfortunately, they do not know that the heart developmentally is a central organ, and hence the chest discomfort, it may not always be pain, it can be other things like squeezing or burning or just heaviness in the chest. And most of the times it occurs in the center of the chest and many times at the back as well. So somebody has this sort of symptoms, you should strongly suspect that there may be a heart attack, early stage of a heart attack. And many times it is mistaken for some form of either gastritis or indigestion, and because of this valuable time is lost. And as you rightly said, there is something known as a golden hour, where if the person reaches the hospital within the first 1 hour, the chances of survival from a heart attack increase significantly. Almost 95% of the patients who have a heart attack can be saved if they reach the hospital within the first 1 hour. That is why it is known as the golden hour. Secondly, if reaching the hospital is delayed, many of them can die either during this first 1 hour or even during the first 3 to 4 hours. And like you said the other day, I think a couple of days ago, there was news about a young actor from Bombay, who had the discomfort through the night. And like I just mentioned, his mother gave him some antacids or whatever, some home remedies. And the morning he was probably found dead. So they have neglected those symptoms. And even though he was young and probably fit and did not have any major reason to have a heart attack, but it is not uncommon to have heart attacks in the young.
Okay.
And many of them do not reach the hospital, like this gentleman whom you just mentioned. So it is important not only to recognize early, to suspect and to reach the hospital as early as possible.
Right. We will come back to the question of the young adults whom we call as getting into this kind of an issue. But before that, probably, why is heart attack so dangerous, doctor?
Now, heart attack is dangerous because it is one of the most common causes of mortality worldwide.
Yeah.
And almost 40% of mortality or death all over the world
Yes.
are related to heart diseases in general.
Right.
Out of that, heart attack is the most common cause amongst all the heart diseases to give rise to this excess mortality.
Okay.
And it is dangerous if neglected, but if treated early and treated properly, most of them can be saved.
Right.
And unlike other organs like liver failure or kidney failure, where it gives you a lot of time to
Right.
recover, reach the hospital and start treatment, whereas heart attacks can be dangerous or
Yes.
can be fatal
Yes.
within a very short time,
That's right.
and that is why it is considered very dangerous.
Right. Unlike larger cities, the metropolitan cities where commuting becomes a traffic is an issue. So how does one ensure that they reach hospital on time, doctor? That becomes a critical because
Yeah, that is why you have
Time.
ambulance services in most cities all over the world. And if the most important thing is to call for the ambulance, or if you are close to the hospital, if you have help available, somebody can take you to the hospital, that would be fastest. Because then it saves you the time of the ambulance traveling both ways. It has
Yes.
to come from the hospital to the house and from the house back to the hospital.
Right.
Now, if help is available or transport is available, the fastest way would be for the person to take help and reach the hospital.
Yes.
One thing important here is he should not try to drive,
Right.
and he should not try to go alone. There
Yes.
has to be help, because on the way suddenly he might collapse and
Right.
nobody will know what happened to
Yes.
him. So it is important that they try to reach the hospital early.
Yes.
If possible in their own vehicle, if they have a four-wheeler, or if somebody can help them, some neighbor or friend.
Yes.
Or if that is not possible, then they should call for an ambulance.
Right. So this is an important message for the onlookers as well. Whenever you suspect somebody having a heart attack, please do not hesitate. Immediately call for an ambulance. This is the first step that you need to do. So how can we help these patients again from when they have an heart attack and prevent heart attack related deaths?
Now, heart attack related deaths can be prevented by re-establishing the blood flow to the heart. Now, heart attack is a problem which occurs when one of the major arteries to the heart is blocked, and that area of the heart muscle which is supplied by that artery, because of no blood size, starts undergoing what we call as necrosis.
Okay.
That is what is called myocardial infarction or heart attack. Now, in this particular situation, it is important to re-establish blood flow to that particular area, and that can be done best by doing what we call as a primary angioplasty.
Okay.
And in such cases, if facilities are available, if they have a heart unit close to their house, they should reach there, and primary angioplasty remains the best treatment for heart attack and to prevent mortality.
Right.
And in smaller towns where cardiac facilities are not available, in such areas they can use a clot dissolving medication
Right.
called thrombolytic therapy,
Okay.
which is good if given immediately within the first 2 to 3 hours of the pain.
Okay.
And if it is given within 2 hours, many times it works as well as angioplasty.
Okay.
But again, that has to be given early.
Okay.
If it is given late, then in such cases it works only in about 30% of patients.
Okay.
So the remaining 60% still will have a blocked artery, and the risk of heart attack remains.
Okay. Right, doctor. So we have recently come out with the second wave of COVID. So what impact has COVID had on cardiac patients and the heart diseases?
Yeah, we all know that COVID affects elderly people more, and the mortality in elderly people is more, especially if they have other risk factors like hypertension, diabetes, heart problems, etc. And because of the scare of COVID, many of them have not had checkups or the consultation with their doctors for long periods of time. Very regularly we get patients who have not seen a doctor for more than 2 years because of the scare of COVID. Now, such patients, their condition can worsen, and many of them, because of various reasons, predominantly financial, have either cut down and stopped their medications, and many of them, their blood pressures and diabetes are haywire now, out of control because there have been no checkup. They are at a very high risk for what we call a sudden cardiac death, because of very poor control of their blood pressure, diabetes, not having regular checkups, and also because the overall heart condition can get worse over a period of time. And that is one aspect. Second thing is, because of the scare of going to large hospitals, even many of them have the symptoms of chest pain or discomfort or sweating or breathlessness. Many of them do not go to a hospital. They just go to their neighborhood family physician and take some treatment locally, which can be dangerous many times. So they should avoid such things. And heart attack is a major problem. So irrespective of the presence or absence of COVID, serious problems like heart attack and stroke and kidney failures and cancer, such things should never be neglected.
Right.
Because just because the scare of COVID, if they do not reach a hospital, many of these other problems can sometimes be fatal quite rapidly.
Yes. And they don't even give you the time to reach hospitals.
Many of them
sometimes,
they do not.
Right? So this is the second important message today, wherein self-medication is never advised. Do not neglect your visits. Please have your regular doctor visits to the hospital and continue taking care of your heart health very well. Doctor, with this, coming back to the question that we discussed, the young actor passing away and the young adults now succumbing to heart attacks, is this a new trend, or of late, post-COVID we have been seeing due to certain changes in the lifestyle, the stress and various other factors adding to it, or what do you think, doctor?
It is multifactorial. Even before COVID, almost 2018, 2019, we were seeing a lot of young adults having heart attacks and fairly serious heart attacks also. And if you look at the demographic data of patients with heart problems, about 5 or 10 years ago, we used to have patients predominantly in their 60s and 70s.
Yes.
And about 5 years ago, it became 50s.
Okay.
Now we see a lot of them in their 40s, sometimes even in their 30s, coming with very serious heart problems, multiple blockages. And if you look at their angiogram, you will think probably he's a 75-year-old.
Yes.
And they would probably be around 35 or 40.
Right.
So disease is coming earlier.
Okay.
It is becoming more severe. And that is related to a lot of things. And India being the diabetes capital of the world, that is one major risk factor. Secondly, smoking is a very common risk factor, especially in the young adults. Thirdly, as you rightly said, stress of daily life is increasing on a yearly basis, whether it is financial or whether it is family stress or pressure at workplace, lot of targets, lot of competition, lot of problems within the organization, many places. Many of them are losing jobs.
Right.
And financial pressures in the last 1.5 years for everybody.
Yes.
There is no person in the whole world who has not been affected by COVID in some way or the other.
Right.
So because of all this stress, heart problems are getting worse and they are coming earlier.
Right.
And we need to be vigilant and make sure that we do not lose precious lives because of heart problems.
Right. I was talking to a young group, they are into alcohol and smoking, but then yes, in moderation. But what is the impact of steroids or drugs that they take? I think that takes a toll seriously on the heart.
Very serious. That is all part of an unhealthy lifestyle.
Yes.
It is not only drugs or smoking or alcohol, it is overall the increase in availability and consumption of high caloric food.
Right.
What is popularly known as junk food.
Yeah.
You eat outside, amount of the quality of oil that is used.
Yes.
Many of them are reused many times, and that can be dangerous and even poisonous.
Yes.
And
multiple factors coming in.
Stress.
But the youngsters, they just spend some time and they consider they are fit, but it works otherwise.
It's a chronic problem of unhealthy lifestyle, which they need to take care and make sure that the lifestyle improves.
Right.
And they are looking at a long healthy lifestyle, only then they will do well.
Yes. Rightly, as you said, Doctor, quickly, before we wind up, certainly we would like to take your advice and some tips to these young adults, especially how they can better their life, prevent heart attacks, and take care of their health in a holistic way, which encompasses everything.
See, there is something known as non-communicable diseases, what is commonly called NCDs by lot of experts. Now that includes many diseases which can be bad, which can be what we call non-communicable and what can be dangerous.
Okay.
And one common factor for most of these is obesity.
Okay.
And overall population with obesity or overweight has increased so much.
Okay.
That is again because of unhealthy lifestyle, affordability, a lot of eating out, lot of junk food, lot of functions, parties, all those things and the amount of time people spend in physical activities has gone down drastically.
Yes, that's the difference.
And the common notion, say about 20-30 years ago was you have to look prosperous and you have to have
eating
is considered something good. And middle-age spread was considered as normal, means you put on weight after the age of 40 or 50. But now we see children in their teens or the school children, almost 10 to 50% of them can be obese. So obesity is central to a lot of these non-communicable diseases. Whether it is heart problem or joint problem or cancer or blood pressure, diabetes, cholesterol. And some of these things can be put together as something known as metabolic syndrome. And this can be prevented to a great extent by a healthy lifestyle from young age.
Yes.
And young parents need to set an example at home for their children by getting up early, doing some physical activity, having a healthy diet, spending time with each other. There's a lot of these small things. You set an example for your children and to follow a healthy lifestyle and make sure that they are engaging in some physical activity.
Engage, and as you said, doctors today, the devices and they are so secluded.
Most of them spend a lot of time on their iPads, computers, cell phones, smartphones, etc. So all those things need to be reduced to a significant extent. And healthy lifestyle is one of the most important things, what message I would like to give people. That to prevent this non-communicable diseases becoming such a big epidemic that instead of living till 60s and 70s, we'll all start dying at 40s and 50s, which will be sad. So I would request everybody to have two things. One, have a regular checkup, make sure your parameters are all okay, your blood pressure, your diabetes, your cholesterol, etc. Your weight most important. And eat a healthy diet, exercise regularly, at least for about 150 minutes of good vigorous activity per week. So that would be helpful, and in the long run that is something which will be good for the whole society.
Wonderfully. So these are some of the important key messages that you saw today coming from the expert himself, which will certainly lead to a healthy and happier life. Thank you, sir, for being with us today and sharing such important insights.
Thank you.